First of all, I'd say there's actually quite a bit, if you'll bear with me, that I do want to talk about with respect to Zika. The State Department is closely monitoring the situation, and we're in contact closely with the Centers for Disease Control and Prevention, the CDC. We're also working directly with the government of Brazil, which, as you know, has been most impacted by Zika and other neurological conditions, as well as other countries in the region. We are pleased to see that the World Health Organization and the Regional Office for the Americas, the Pan-American Health Organization, are taking a strong leadership role and are directing critical research efforts and other response activities. As you know, the CDC issued updated guidance on Zika on the 3rd of February, just a couple of days ago, and I'd refer you to them for additional information on that. The U.S. government is combating the Zika virus through multiple lines of effort. Obviously, the CDC's got the lead in terms of providing expertise, working with health officials. The president met with the national security team and the health team in late January to discuss the spread of this and emphasize the need to accelerate research efforts, to make better diagnostic tests available, to develop vaccines and medicines, to improve mosquito control measures, and to ensure that all U.S. citizens have the information they need about the Zika virus. We've posted some of that on our website. I know it's on the White House's website as well. And again, all federal agencies are working together on this and collaborating with it. At the State Department, we lead on several critical efforts in close coordination with the White House and Health and Human Services, CDC. We lead on the diplomatic front, engaging with foreign governments, including coordination with affected countries and those ready to assist in the response. We also lead on getting timely and accurate information to U.S. citizens traveling or living in affected areas. Again, we've got quite a bit of information on our website, and in supporting all U.S. government employees and their families at our overseas posts. Under the leadership of the Deputy Secretary for Management and Resources and the Assistant Secretary for Oceans, Environment, and Science, in coordination with the Bureau of Western Hemisphere Affairs, we have established here at the State Department a Zika coordination team and a broader working group to ensure a robust and coordinated department response. In our response to Ebola last year, we learned important lessons about how best to put this kind of coordination mechanism in place, and we're taking lessons learned from Ebola to do exactly that. As for guidance to give American travelers, we obviously defer first and foremost to CDC on public health guidance. They've issued a travel alert level 2, which says it's called Practice Enhanced Precaution for countries where there is active Zika transmission. They further recommend that travelers take measures to protect themselves from mosquito bites. They also recommend that until we know more about the connection between Zika and birth defects, that pregnant women in particular consider postponing their travel to Zika-affected areas, and women trying to get pregnant strictly adhere to steps to prevent mosquito bites. Now, we have, as I said, links to all this information on our website for Americans traveling abroad at travel.state.gov, and this site will be updated as further information becomes available.